Different ways that children on the autism spectrum communicate. Well, many children are non-verbal and they won't actually speak to you directly at all. They may make noises or sounds. Those are ones that you need to learn how to recognise and to know whether a squeal means that it's pain or whether the child might be thirsty. Some children who are non-verbal will take your hand and will pull you along to whatever it is that they want you to be a part of or to do for them. But often we need to look at children who are non-verbal, and we need to look at their behaviour. And we have a very favourite phrase here, and that's behaviour itself is a form of communication. Some children who are non-verbal will also do various things like stimming. That means different actions. It might be flapping, it might be turning a circle, and it could represent that they're excited, they're happy, or that they're frightened. So we need to know our children, and we need to be able to take a person-centred approach and recognise what type of communication they're giving. Now, some children are verbal and some children are going to be shouting at you or screaming at you. Some children will talk in a very pedantic manner and will actually offer you information that you don't necessarily want to know about their particular interest or hobby. One of the things that we do need to recognise, though, is that the majority of children on the autism spectrum are visual learners and will respond much better to visual stimuli than they will do to the spoken word. They may not hear and retain everything that we want to be able to tell them through the spoken word. Some of the examples that we've given here use echolalia. Echolalia is where the child echoes lalia, language, and there's another version of that which is echopraxia. The child will echo but echo behaviour. So there are many different forms of communication that a child may use. Every child that you're going to meet is going to be different. No two children are going to communicate in the same way. We need to ensure that we're reflecting their communication needs by taking a person-centred approach and working with the child to communicate in the most effective manner.